Hello everyone, I'm Jessel May Ferrer from BSN3H. For today's video, I'm going to teach you how to use an incentive spirometer. But first things first, what is incentive spirometer? Incentive spirometer is a device used to provide visual reinforcement for deep breathing by the patient. It also assists the patient to breathe slowly and deeply to sustain maximal inspiration while providing immediate and positive reinforcement. The goal of this procedure is the patient accurately demonstrate the procedure for using the spirometer. The equipment, we must check for the incentive spirometer. Before we go to the procedure, let us first know what are the three nursing assessments in using incentive spirometer. First, the nurse needs to assess the patient for pain and administer pain medication if prescribed, especially if deep breathing may cause pain to the patient, because presence of pain may interfere to the learning and performing of incentive spirometry. Second, we must need to assess the patient lung sound before and after using an incentive spirometer, because we need to do this in order for us to know if there is an improvement or changes to the lungs sound of the patient. Last one, to assess the patient vital signs and oxygen saturation to provide baseline data. For the procedure, first thing to do is review the chart for any health problems that would affect the patient oxygen status. Bring necessary equipments to the bedside stand or overbed table to minimize the time and effort. Perform hand hygiene and put on PPE if indicated. This is to avoid the spreading of microorganisms and for safety measures. Identify the patient using at least 2 identifiers such as asking patient's name, date of birth, and wristbands. If possible, close the curtain and door to the room. Explain to the client what are you going to do and why it's necessary and why you're going to do it to the patient. Good morning, ma'am.
Hello, ma'am. I'm Jessel May Ferrer from NAUST, your student nurse for today. May I know your name, age, and birthday?
My name is Danica Freitas Mendoza. I'm 12 years old and my birthday is on July 18, 2009.
Okay, ma'am. May I ask if you have already encountered incentive spirometer?
Not yet.
Okay, ma'am. So, this device called incentive spirometer, it helps your lungs to expand and by helping you to breathe deeply and fully. So, all you need to do is put your mouth here in the mouthpiece, then take a deep breath in and let it out. So, do you understand the procedure, ma'am?
Yes.
Okay, ma'am. So, let's start the procedure.
Assist the patient to an upright or semi-Fowler's position. This position allows for better lung expansion, improving breathing by facilitating oxygenation. If possible, remove dentures if they are fit poorly because it may affect the spirometric values. Assess the patient level of pain. Administer pain medication prescribed if needed. Demonstrate how to steady the device with one hand and hold on the mouthpiece with the other hand. If the patient cannot use the hands, assist the patient with the incentive spirometer. Instruct the patient to exhale normally and then place lips securely around the mouthpiece. Instruct the patient to exhale normally and then place the lips securely around the mouthpiece without using nose.
Inhale.
If desired, a nose clip may be used. When the patient cannot exhale anymore, the patient should hold his or her breath and count to 3. check position gauge to determine progress and level attained if the patient begins to cough. Split the abdominal or chest incision. Instruct the patient to remove lips from the mouthpiece and exhale normally. If the patient becomes light-heeled during the process, tell him or her to stop and take a few normal breaths before resuming incentive spirometry. Encourage patient to perform incentive spirometry 5 to 10 minutes every 1 to 2 hours if possible.
Okay, ma'am, if you need anything, don't hesitate to call me. And if you're experiencing difficulty of breathing, you may use incentive spirometer 5 to 10 minutes every 1 to 2 hours. Do you understand, ma'am?
Yes.
Clean the mouthpiece with water and let it dry. Avoid using alcohol because it can affect the taste of mouthpiece. After the procedure, remove PPE if used, perform hand hygiene, assess response, and vital signs and document.